Okay, Alexander from Portugal. What are the possible way of treating long-term Bell's palsy and how does this treatment work? There are several available options in general in the world. Alexander, thank you for your question. Very interesting and thoughtful one, because there are a lot of possibilities to treat the long-time complications, and there are several. I will start not in the order of their effectiveness of importance, but just one by one. The most often recommended treatment option is the Botox injections to reduce the stiffness, to reduce the tightness, to reduce the intensity of synkinesis. And Botox injections are as easy, as simple way to do it. You just come, get injection, and enjoy the results. Well, all going well. Enjoying the results for several months, and then after the effect of Botox subsides, you come back, you get new injection, enjoy it for another several months, and so on. Well, my personal opinion about Botox is that it does address the symptom without addressing the underlying cause. Because Botox is a commercial name for botulinum toxin, which is, direct translation is sausage poison. It is a toxin which actually blocks the transmission of the electrical signal between the nerve ending and the muscle fiber. So the botulinum toxin, when it's injected in the tissue, it sits on the nerve ending and prevents the electrical signal to jump from the nerve to the muscle. The signals keep coming in the same unchanged structure from the brain, but they cannot jump. It's like, like a champagne bottle. The gas tries to go out of the bottle, but there is a cork on top, which does not allow it to leave the bottle. With the time, and this change, by the way, it is irreversible. So this cannot be reversed. With the time, the nerve fiber would grow a side branch to reconnect to the same muscle fiber, and the transmission is restored. And then again, if you make another injection of Botox, it goes the same way, and it is an endless series of injections and waiting for the effect to subside, and so on and so on. Whether it is something that you consider acceptable to you, I leave it totally up to you. And once again, I believe that every patient is completely free to decide what to do about his or her condition. The only thing which is very important, that you obtain as much as possible information about what it is that is offered to you and what it is not. Another option for the treatment of residuals and complications is what is called selective neurolysis. Selective neurolysis is an invasive procedure, not a big invasive, but a relatively small invasive, when the surgeon would destroy chemically or mechanically small branches of your nerve that are connecting your facial nerve branch to the muscles, and by that it will again block the arrival of certain part, not fully, part of the signal to contract that muscle. For example, usually it's being done on the depredator anguli oris muscle, the muscle that pulls down the mouth corner. It's actually the muscle that holds back your smile. Normally, there is a major cause for asymmetry of the smile. Again, it is irreversible procedure. Once you do it, it's done. It's forever. Well, its effectiveness can be disputed because, first of all, it does not stop it completely because it does not address the source. It just, partly disables the ability of certain facial muscles to receive signals from the brain, but the structure of those signals is still unchanged. There are other much more invasive surgical interventions like nerve graft, muscle flap transposition, and so on. I would not advise it to do in the, let's say, cases of regular facial palsy and its complications in the form of synkinesis, tightness, and everything, because the nerve graft is a really serious surgical intervention, and it is recommended in a very, very heavy cases. Well, again, from my point of view, when it has been established that the facial nerve is completely dead, cannot regain its functionality by itself, and then what is being done, then they take a part of the nerve from your leg, put it here, connect it to the healthy side, go all the way here, and connect it, cut off your affected nerve and connect it to here in a hope that it will grow all the way from here to here and back to your smiling muscles. Usually it is being done on the to revive the smile. But it's, again, we have had a few patients with that. They were not happy. It's not to say that it's in all cases it doesn't deliver the expected result. Well, those who have achieved their goals, they don't come to us, obviously. So in that respect, I cannot tell you. But it is, again, if the nerve fibers have to grow distance of about 25 centimeters here and there back, it will take something about a year just to see the first results of that operation. Well, and obviously underway, not all the nerve fibers that have started to grow, they will grow all the way and reach the desired destination, which is your zygomatic major muscle. Some of them, or actually most of them, I would say, can stop before they reach your muscle. So the effectiveness of that procedure is doubtful, at least in my perspective. Again, I'm not saying that it's not worth doing it. I'm just sharing with you my opinion, actually our opinion here in the clinic about that specific procedure. Muscle flap transposition, it is really, really intensive intervention. And again, in the cases of classical facial paralysis and its complications, of which I have seen the pictures of those of you, and most of you have sent me your pictures so I could see it, I would not advise it. It is really serious stuff, and it is not something which will really restore your smile, for that matter, any close to what it used to be at the beginning. And again, so I don't advise it.